All right, well, we're going to get started tonight. Um, Good evening. My name is Amonica Kumar, and I'm one of the gynecologic oncologists at Mayo Clinic in Rochester.
And I'm Dr. Jamie Bachman-Gomez. I'm also a gynecologic oncologist in Rochester at Mayo Clinic.
I am very excited to be here tonight, and on behalf of the Foundation for Women's Cancer and Mayo Clinic, welcome to this evening's webinar. We hope everyone's staying really safe and healthy in this really turbulent time. I'm excited to present our last webinar in our four-part series talking about building and strengthening resilience during cancer treatment. I'll just remind everyone that we did have three others. The first was on genetics and PARP inhibitors. The second was on advanced care planning and cancer legal care. Those were both held in November. And then last week we had an excellent discussion on clinical trials and immunotherapy. So we invite you to revisit or watch that material in the future. It will be archived onto both the Foundation for Women's Cancer website and eventually the Mayo Clinic website. And we'll have that information at the end, some QR codes that you guys can link to. I know, again, we wish we were in person, but I think we've all made the best of this current COVID events, and we're so happy to have this opportunity to speak with our patient community in this webinar format. Before we get going, I do want to thank our sponsor. It's Clovis Oncology, who have provided sponsorship support for the webinar series. And then I'm just going to talk about a couple housekeeping items. We are going to have a few polling questions throughout the broadcast tonight. So just like we've had before, so just go ahead and click on the screen when they come up. You can also ask questions at any time using the Q&A. So at the very bottom of your screen, there is a Q&A portion, and so please ask your questions there. There's also a chat function, and we're trying to use that for other issues. So if you have any technical issues, we'll be playing videos of some of the presentations, so make sure you're connected to audio. If you're calling on the phone line, that might be difficult to see. You won't be able to hear that video content. So if you have any technical difficulties, just reach out via the Q&A box or the chat box. Also in the chat box, we will, closer to the middle to end of the presentation, put up some links to some materials that you can use in the future of some materials we'll be referring to. So we're gonna just start with a few polling questions that we wanna use to get to know who's in our audience today. So as they come up, just click on the screen. So same question from before. Are you a patient survivor, family friend, provider? Fantastic. So mostly patients and survivors, and some providers and family and friends. Are you from Minnesota or are you from somewhere else? Great. So again, lots of people from Minnesota, but the majority from other places around the country. Welcome. We have a question about how many times you participated in a Foundation for Women's Cancer Survivors course. Great, so a lot of first timers, maybe once before, and even some people who've been in many courses before. Now we're going to talk a little bit about nutrition today. So I'm wondering what people feel like as far as nutrition and a part of their cancer care and overall health. Yeah, so I think like many of us, the majority of patients and people on the webinar today think that nutrition is a very important part of their cancer care and overall health. The second question is about regular exercise. Do people exercise sometimes? Wow, we have a really active group. So half the patients participate regularly, and the rest, most of them, sometimes have an exercise routine. Great. I think that's the last of our polls. Just close that out. So today, our wonderful panelists have created a unique presentation to address many of our issues that come up during cancer treatments and cancer survivorship. Our first panelist is Patty Bartholomew. She's a 4-year survivor of ovarian cancer and has long been a proponent of the benefits of diet and exercise for positive mental and physical well-being, and has included following useful diet and exercise through various steps of treatment and even outside of treatment. She's joining in our first presentation by Dr. Denise Milstein. Dr. Milstein is assistant professor in medicine and consultant in women's health and the chair of the integrative medicine program at Mayo Clinic in Arizona. She is a board certified internal medicine physician and completed her degree at Loyola University in Chicago. And then she completed internal medicine residency at the University of Massachusetts Medical Center and her fellowship in integrative medicine at the University of Arizona. Today, we're going to take a really unique and really fantastic approach where we're having sort of interview style. Patty's going to tell her story as an oncology patient referred to Dr. Milstein, and then following Dr. Sood to talk about the integrative perspectives on dealing with cancer and cancer treatment. The doctors will bring their expertise on diet, exercise, and mindfulness, areas sort of outside of our classic chemotherapy surgery, what we've been talking about up until now. They will talk about the things that patients can do to help themselves before, during, and after treatment. So first we'll listen to Dr. Milstein and consultation with Patty here.
Hi, Patty. It's great to meet with you today and do a type of virtual integrative medicine consult. Thanks for taking the time to share your experience and to give us a chance to talk about using integrative medicine in cancer care. If you could, I'll just introduce myself briefly and then have you tell us your story. So I'm Dr. Denise Milstein, and I work in integrative medicine at Mayo Clinic in Arizona, seeing a lot of patients who have had a cancer diagnosis. So tell us your story.
So I'm really happy to be meeting with you, and this is something that I'm really interested in. I've always been very proactive about my health and have been rigorous with my annual physicals, and I track my exercise and I watch my diet. Very careful about that. And I've not really had a health problem of any note. Up until March of 2016, I noticed I had a swollen lymph node in my groin. So I went to my primary and she said, it's probably nothing. But did a transvaginal ultrasound and said, no, it's not showing anything. You're fine. Just keep an eye on it. So then later that summer, I was working out with my trainer, and my oblique, which had been bothering me for a while, was really hurting. And he said, you need to go get that checked out right away. So that night I went to the urgent care and they did an ultrasound and a CT scan and said, nope, there's nothing there. You're fine. You probably just strained your oblique. I said, okay. And then in September, on Labor Day weekend, I got terrible abdominal pains. And so Tuesday after Labor Day, I called my primary and went in, and they did a CT scan with contrast this time. And they called me the next morning and said, we're so sorry, but you have cancer, and we'll make a referral to Mayo for you. And I said, great. The following day, I was down at Mayo, and which was really fortunate that I didn't have to wait because, the brain had started to twirl.
Sure.
So I went down and I first met with the surgeon, and went through, the cancer, was told I had stage 4 ovarian cancer. And, she said that, the survival rate for this kind of cancer isn't very good. And I said, I get it, but somebody's got to be there, and it might as well be me. Back to being proactive. But I met with a variety of doctors, the oncologists. I had biopsies and consultations, and I was told what my treatment would be. But it was all, pretty focused on the medical side. I asked about trials, was told about 2 that were available. And I asked about information that was available to help me understand what kind of diet might be beneficial and what kind of what might help me during my treatment. And I was told there really wasn't anything, and that I should just really focus on trying to manage the nausea and deal with a likely sore mouth that I'd get. And I also asked about exercise, and again, there just really wasn't much that was offered. And the feeling I got was that I'd be really busy dealing with the side effects of chemo and really wouldn't have time to focus on diet or exercise. But at the time of my diagnosis, I also called my trainer and told him I'd have to stop training. And he was emphatic. He said, absolutely not. You have got to stay with your training. And I wasn't really able to maintain the same intensity level. And that was on purpose. The goal was to keep me moving and maintain my energy level. It was more about mobility and movement and stability. And we follow the functional movement system, which I know Mayo has also adopted. I've seen articles on their site about it. But it's more of a holistic approach to moving in everyday life. And that's what made sense to me. I also continued Pilates, but on a much lower spring weight level. And I walked on a regular basis. I've maintained those even after treatment. But at the time, I was scheduled for 3 cycles of carboplatin paclitaxel, had debulking surgery, and then followed by 3 more cycles of carbo and Taxol. And then I was declared NED in March of 2017 and returned to more vigorous exercise, a more specific diet. And then during COVID, things clearly got more contained. And, thankfully, my trainer who's with Vina Fitness, was able to immediately pivot and get me on a FaceTime workout, so I'm able to work out remotely. But in April this year, I found that my CA-125 was going up and did a CT scan, and they found I had a recurrence. So we chose to start a 6-week cycle of carbo and Taxol again. And as of September, my CA-125 is back down to low levels and my CT scan is clear. So I'm calling myself NED again. But
that's wonderful news.
It's terrific news. And so I'm, back refocusing on, diet and exercise. So those are the kind of things. And what other things I can do. I know diet and exercise isn't going to fix the cancer, but I think they can help support me in my cancer journey. So that's what I'd like to talk with you about today.
So Patty, thank you for sharing all of that. I have an analogy that I want to throw out for you that was taught to me by a really wise physician named Dr. Gladys McGarry. I almost called her a wise old physician, and I actually think I can call her that because she just celebrated her 100th birthday.
Oh my gosh.
But she talks about the person like a tree with a really intricate root system, and the cancer is like a boulder that gets in the way of that root system. And when you come in for cancer care, there's so much focus on that boulder. Should we cut it out? Should we poison it? Should we blast it with x-rays? What can we do to take care of this boulder? but you're not the boulder, you're the tree. And in integrative medicine, we focus on how do we keep that soil as healthy as it can be so the tree can continue to thrive even as it goes through these necessary treatments. And I think it's particularly telling somebody like you who's really healthy. You'd had some musculoskeletal issues prior to this diagnosis, but you hadn't really embarked on that chronic disease monitoring, maintenance therapy, chemotherapy. All of that was brand new to you. So I really appreciate that you've been willing to share that with us. I wonder if you would feel comfortable telling us a little bit more about your diet. And let's focus on your diet that you're eating now, where you're in this phase of no evidence of disease.
Okay. Throughout my adult life, I have focused on a diet to maintain, not only to have a healthy diet, but to maintain my weight. When I was younger, I was heavier, and I didn't think that that was a good thing to continue on with in my adult life. So I have, I don't eat a lot of sweets. I'm not perfect, but a little bit of sweets is okay on occasion. I just don't live on a diet of them. I'm clean protein and organic vegetables and fruits are the primary parts of my diet. I've looked at paleo. I've done some paleo and brought some paleo concepts into my diet. And the theories that I've read say that, the goal is to be 80% clean, 20%, so much. And I try and maintain that as a minimum, but I aspire to being better than that.
I like what you said about the diet in various stages of your treatment and your journey. So for example, when you're in the middle of receiving chemotherapy or when you were recovering from surgery, I do think that there's a role to be a little more flexible with the diet and eating things that can stay down, don't make you more nauseous, help you to maintain your weight. But then I completely agree, when you are able to be more discerning about what you actually eat. I have 3 rules that I tell people. So the first one is eat real food. So every ingredient of every food that you eat, you can draw it back to the earth. Where does it come from? And also, would your grandmother recognize it as food? So if you're putting stevia in your coffee or tea, stevia actually comes from the chrysanthemum. I'm pretty sure your grandmother wasn't eating out of her window box, that kind of thing. So my first rule, eat real food. And then I do like to encourage people to be careful with added sugar and not to replace it with the sweeteners. And then my third rule is to eat what counts. And that's the 20% rule that you're talking about. So, if you're with family and somebody's making pancake breakfast with maple syrup and you feel like you'd like to eat that, every once in a while as a treat, I think we should all eat those foods that we really want to eat, that we enjoy, and that often, like in that example with your family, is a lot more than just the pancakes and the syrup. It's about being together and cooking together or sharing a meal together. So I think it's great how you've described your diet. I want to talk a little bit more about your exercise as well. So you made a comment about using diet and exercise to keep you healthy, but not directly to affect the cancer. But it turns out that people who exercise actually significantly reduce their risk of recurrence. But I think it's important to remember that has to be modified for where you are and where your body is. So you said that you were pretty fit coming into your diagnosis.
Absolutely. I worked out a couple days a week, did Pilates training. I walk 2 or 3 days a week, and a walk is, 4 to 5 miles or was at the time. So you're very fit.
So that is really important in terms of being able to withstand your treatment, tolerate your treatment, and actually finish on schedule. And then I love that your trainer came back to you and said, you are staying with me, even though we have to modify. So that is one caution. If you're used to being able to do Pilates for an hour and then you're in the middle of treatment or you're recovering from surgery, obviously that has to be something you back off on. But the intensity of your exercise is what's most important, and that is based on where you are today. So not where you think you should be, where your peers are, but where you are today and what you can tolerate. What about supplements, Patty? Have you taken any of those throughout the journey?
I have. We live in the northern climes, so especially in the winter, vitamin D is really important. In the summertime, I try and get outside and allow some access or some exposure to the sun to get the natural vitamin D. Winter here, it's kind of hard to do, so I take more supplements. I include vitamin C supplements if I'm not eating a lot of citrus. I have osteoporosis. I do have that, so I take a bone builder once a week. Plus, I take a calcium supplement every day that also includes boron and magnesium and K, which helps with the absorption of the calcium. I have gotten into, and it's one of my questions for you, I don't know if it's a fad or if it makes sense, but black elderberry, it's received a lot of press. It's got a lot of really good reports on its ability to help supplement your immune system. So I, three times a week, I'm adding the black elderberry syrup to my water, and I drink a lot of water. My goal is 3 quarts a day.
That's fantastic. Yeah, let's talk about the ones that you've mentioned so far. So vitamin D is really important to consider more like a hormone than to consider it as a vitamin. And the reason I make that distinction is there have been some associations with having too much vitamin D in the system, and then obviously some associations with having too little. So there's kind of a sweet spot there. So if you don't know what your vitamin D level is, it's probably a good idea to ask your treating physician. I'm also a believer in vitamin C, although while some is good, a lot is not necessarily better. So I'll typically recommend that people take about 500 to 1,000 milligrams of vitamin C through a supplement, or they could get it from their diet. I live in Arizona where we have many, many citrus trees. So this time of year, people can just go in their yard and pick an orange and eat an orange a day, and that's adequate. Your bone builder is interesting. So calcium is important. I prefer when people get calcium from their diet, but some people choose not to have dairy or can't tolerate dairy, and then they have to get it in the supplement form. The magnesium is one of my favorite supplements because so many of us are low in magnesium, and that can make you achy, can make you more anxious or have a hard time sleeping. So I'll replace magnesium a lot. Be a little cautious with the vitamin K. So vitamin K is part of the clotting cascade. And by the fact that you've had a cancer diagnosis, we want to be cautious with anything that might further increase your risk of developing a blood clot. And the data for osteoporosis and vitamin K is pretty weak. So it's not been shown to reduce fractures, which is what you care about. You don't really care that your x-ray looks prettier than it did prior to being on vitamin K. So you just would be a little cautious. And then elderberry, I think it's worth mentioning that we're having this conversation in December of 2020. So there's been a lot of interest in elderberry in this year of the COVID pandemic. Elderberry has some evidence for influenza, and there's some data that it might be good to take prior to a COVID exposure. But then once you get COVID, we actually ask people to pull back on elderberry because perhaps the part of your immune system that needs to surge to fight off COVID is blunted by having the elderberry in your system. Now, there's not strong science behind that, but I thought I'd just mention it because of the nature of the times that we're currently living in. Before we click over to a handful of slides with some resources and things like that, would you just tell us if you used any acupuncture or massage or other integrative medicine therapies in your treatment?
Pre-COVID, I used massage and acupuncture. Acupuncture wasn't as effective for me as it was for some of my friends going through cancer. Massage tended to be more beneficial for me. But with COVID, I'm just being really careful, especially having gone through the treatment again this fall, or actually it was over the summer. And, my blood got a little beat up, so I just didn't feel safe being in a close space with a provider.
That sounds really wise to me. And in regards to acupuncture, we use this quite a bit for management of pain, of anxiety, struggles with sleep, or with hot flashes. We'll use it for nausea as well. But you're exactly right that not everybody responds. So in our practice, what we do is have people come in and then they get a series of treatments. And if it's not helping, we just back off of the acupuncture. But I like to hear that you gave it a try. In terms of massage, I really appreciate that you incorporated that, because culturally, I think we consider massage to be a treat or a pampering type of therapy, but actually it's so powerful. But I do want to comment that when you've had manipulation of your body related to cancer treatment, particularly surgery, it's so important that your massage therapist is trained in oncology and knows what's safe and what's not safe. Inevitably, after the discussion of acupuncture and massage, most people ask whether or not this is covered by insurance. And I'll tell you that, at least here in Arizona, massage is almost never covered, and that acupuncture actually is pretty well covered, except by the government payers like Medicare, unfortunately. But maybe that'll change. So if it's okay with you, I'll just flip to our slides and go through those really quickly so people can see some of the resources.
Yep.
So I'll start by just talking about integrative medicine in general. There is through the NIH, or the National Institute of Health, the NCCIH, the National Center for Complementary and Integrative Health. And these are the various domains in that practice that are included. You're about to embark in a much more detailed discussion of the mind-body medicine component with my colleague, Dr. Richa Sood. One of the struggles with integrative medicine is finding quality information about it. So I wanted you to know that as clinicians, we typically rely on guidelines. And for me in my practice of integrative medicine, as it pertains to cancer care, I really do depend on what's called the Society of Integrative Oncology. And they put out guidelines for us regarding what's safe to use, what's helpful, what might not be so helpful, and what's dangerous. So a couple of things that we talked about. One is exercise, and I love this graph because what this is showing almost 3,000 patients who had a cancer diagnosis, some who exercised and some who did not. And the ones who exercise do better. They live longer. The outcome is actually mortality, which is a huge outcome when you're talking about cancer treatment. And then I added this slide to show another large study of 4,000 patients who showed improved quality of life, management of their fatigue, pain, anxiety, sleep. And the image to remind you, it doesn't matter if you're doing your Pilates, you're walking, hiking, biking, do what you love so that you keep doing it. Diet is so important, though needs to be modified for how you're feeling overall. And here we have information from the World Cancer Research Fund and the American Institute for Cancer Research. And this is not very earth-shattering diet advice. Maintain your weight. Don't drink a lot of soda or sugary drinks. Don't eat a lot of energy dense foods. So that's typically sweets or fried foods. Eat lots and lots of plants. Don't eat a ton of red meat or meat that comes from mammals, particularly if it's processed, and then limit your salty and processed foods. I wanted to tell you about 2 cookbooks that I recommend frequently. The first is this Cook for Your Life by a cancer survivor, Ann Ogden Gaffney. I love this cookbook because she wrote these recipes planning to make them for herself. So you don't need to be really interested in cooking to make these recipes. The Cancer Fighting Kitchen by Rebecca Katz is beautiful. A lot more unusual ingredients in that one, so it helps if you live with somebody who really has an interest. We already talked about massage and how important it is to work with an oncology massage trained provider, but I put this slide in to remind you that massage can be helpful for pain, particularly after surgery, and reflexology can be quite helpful. Reflexology is done only on the foot. So this one, you don't need to worry so much about whether it's been an oncology trained provider or not. It's usually less expensive, easier to get, and you don't need to undress. So just a lot easier. Quick fly through a couple of supplements, which we already started to talk about. Most cancer survivors are taking supplements, so feel free to discuss them with your providers. I am a proponent of using a multivitamin if you restrict your diet in any way. Now, Patty, you eat so healthy, I'm not sure you need to take a multivitamin, but if you're choosing to take one, be really cautious with the forms of vitamin A. It should be mostly beta carotene, that it's not too much folic acid or vitamin E, that you're getting enough zinc to copper, and only iron if you're still getting your period, if you're still a menstruating female. Be cautious with the serving size. So if they're telling you to take 6 a day and you're only taking 1, you're really not getting the benefit. Watch for added sugars. And if it gives you a whole list of plants that have been added at the end, you're probably not getting any benefit from that. So you probably don't need that complicated product. Real quick on the antioxidants, eat them all you want. Your berries and your green foods. You see lots of healthy antioxidant foods in that picture, but don't take them in a supplement form unless somebody specifically tells you why. And the reason is they're easy to overdo. They've been shown to cause people to die earlier, which is another big outcome again. And then there's often this worry whether it might interfere with treatment effect or treatment toxicity. We talked already about vitamin C, and really we don't have data for IV or intravenous infusions of vitamin C, so I wouldn't encourage the regular use of that. And then what we didn't get to was turmeric, which is a nice anti-inflammatory that has been shown in cell studies to change cancer cells to behave more like normal cells. You do improve your absorption of turmeric if you take it with pepper. You can see that there. 800,000 supplement products on the market last time I checked. There's too many for anybody to know about. So here's a couple of resources. The NCCIH I already mentioned. They have a lovely component called Herbs at a Glance through the NCCIH if you're interested in botanicals. And then a subscription service called consumerlab.com will actually give you detailed information about whether supplements have in them what they say they have in them, which is a huge part of that industry. And then finally, 2 books that I like very much. I'm partial to the original Anti-Cancer by Dr. Servan-Schreiber, who was diagnosed with brain cancer when he was in medical school. And like you, Patty, he was told he probably only had about 3 months to live. And he said, no way, I'm going to be one of those outlying survivors on your dot curve. And so he went on to live for 18 years by changing how he lived his life. He passed away, and so his book's been updated by Dr. Lorenzo Cohen and colleagues there in Anti-Cancer Living, and they've actually gone forward to put out a series of web-based classes that are completely free at anticancerlifestyle.org. Normally, I would talk to you a great deal about mind-body medicine, stress management, and resilience, but we have brought in a ringer for that part of this discussion. Dr. Richa Sood is my colleague in women's health and integrative medicine at Mayo Clinic in Rochester, and I look forward to hearing your conversation with her.
Thank you.
Thank you both. That was really awesome. And I think you guys bring up so many really important topics. I can say, you know, as a oncology provider, this is a conversation I have with all of my patients, and it's really hard. I mean, I'm so glad you guys brought up both the sort of idea of sometimes you just have to try things like acupuncture and massage, and I don't know which one's going to work best. And for me, and also the fact that there is some data, there's not enough data, we know that, and how do we do this safely? As Dr. Milstein mentioned, next we are going to hear again from Patty again, and I'm happy to introduce my colleague here in Rochester, Dr. Richa Sood. Dr. Sood is an internal medicine and women's health provider at Mayo Clinic. She's a certified menopause practitioner and resilience specialist, and is currently an associate professor in medicine at the Mayo Clinic in Rochester. And she is actually the lead for the education initiatives at the Menopause and Women's Sexual Health Clinic. So her primary areas of interest are menopause, female sexual health management, stress management, and resilience enhancement, especially in women and cancer survivors. Before we get to that presentation, we're going to just have a couple more poll questions just to get to know and get you all to be thinking about a few things. So we'll bring those up. So first question, I'm so curious, has a member of your health team discussed mind-body wellness with you? Interesting. So a little bit of a mix, but you know, a huge, more than half the people on have said that they have not had this discussion at all. And then, how often do you think about your cancer diagnosis, or if you're a family member or friend, your loved one's cancer diagnosis? Thanks everyone for your candor. So most people, this is something that they're thinking about many, many times a day. And I think that just highlights the importance of the mind and body connection. So now we'll move forward with our presentation.
Introduce myself real quick. I'm a provider in internal medicine, women's health at the Rochester campus in Mayo Clinic. And thank you for this visit. I will be talking about some mind-body approaches during this session. So tell me a little bit about yourself, and then we will go further from there.
Okay, thank you. It's a pleasure to meet you. When I got my cancer diagnosis, to say it wasn't unsettling would be a gross understatement. The thoughts that raced through my head were so wide-ranging. You know, what about my kids? And my kids are adults, and I still worried about them. How long do I have? How bad is this going to be? Who can help me? Where's the best place? And why me? You know, my response to that eventually was, why not me? But, you know, it all races through your head, and it's really hard to come to terms with a lot of these things. And, you know, I initially sunk into the pity pot and pulled myself out of that, realizing that wasn't going to get me anywhere. So laid out a plan for what I could do. So I'm going to, you know, kind of go over that, but really what I'd like to hear from you is ways to deal with these things. But here's what I've done so far for dealing with what I call my emotional self-care. You know, I decided to gather a close group of friends and family who'd be my support group. And I started a Caring Bridge page to keep them informed. But I limited who could see my page And I understand from others that they open theirs up and they get notes from people far and wide they don't even know. And that's great for them. That's just not my style. I'm a little more private, so I kept mine closed. But my support group took turns driving me to treatments. They'd buy me coffee while I was treating, because I loved to drink coffee while I was sitting in the chair. But there were great opportunities to talk, and I gave my group kind of a firsthand view of what I was going through. And that helped them feel a little more supportive, but it made me feel I was helping them. So, it was kind of a win-win on both sides, and I enjoyed the company. And these people also brought me food. Ginger cookies were wonderful. And they helped me around my house, all things that relieved stress and pressure from me. But, fast forward to this last year, and COVID really changed my group's ability to help. And I had to limit the people I could be in contact with, as, my blood got more beat up during the second treatment. And I couldn't go to the gym. And, thankfully, my trainer was able to work out via FaceTime with me. And I had also connected, back originally with the Minnesota Ovarian Cancer Alliance, MOCA for short, and they have support groups, which originally we met in person, and now we've moved those to online. And being able to stay in touch with a group of survivors and talk to each other about what we're going through, things we've experienced, that's really been helpful. The other thing was, through it all, I felt it was really important to look my best and have a good attitude, or at least show a good attitude. Used a lot of humor. I would sit in the treatment chair watching comedy videos, just to keep my mood elevated and not get all bummed out about what was going on. Mm-hmm. But I still had little trips into the pity pot. And, for some reason, waking up at 2:30 in the morning worrying about things was a common occurrence. And I've heard it from other people too. Yeah. It's really brutal, and trying to settle your mind at that time of day is really hard. Mm-hmm. I don't think anybody ever truly gets off the emotional roller coaster, but it's a question of the intensity of feelings and how do we deal with those, and what things can we do to help manage that for ourselves, for our own self-care.
Right. Wow. Well, I must first compliment you for your willpower, your courage, and the choices that you've been making along the way, recognizing that this is such a difficult place to be, and you could be deeper down that rabbit hole, but you made conscious choice multiple times to stay afloat and to tap into your strengths, into your resources, and into ideas that uplift you, at least for the moment. That's brave, to say the least. Kudos, compliments to you. Thank you.
Thank you.
So, life is stressful, and a diagnosis of cancer is just one of the most stressful things a person can experience. So that stress can get easily overwhelming because there's one of us, and there is an excessive demand on a system that has resources. It can increase to some extent, but there's a limit to that. So sometimes I'm reminded of this picture where there is a horse trying to pull a cart, and the poor horse is going legs up because the cart is too heavy. That's one of the situations we run into. And with the cancer diagnosis itself, which is just the tip of the iceberg, there's a lot of stress. But then there's the bottom of the iceberg. Like you said, you asked a lot of questions. What about my even grown kids? What about me? What about the treatment? What about the side effects? What about the prognosis? The loved ones, the finances? I mean, there's lots and lots and lots to process, which ties into our 2:30 a.m. experience. You use the term brutal. Yes, there's too many open files to process. And many of these files are questions that we don't have answers for. They create a semblance of like loss of control. Humans hate it. And sadly, we are faced with it just too often. So that lack of control, and then the other big question, lack of meaning. Why me? Well, you changed it for yourself, why not me, which is really brave. But yes, why me is a big one as well. So loss of meaning, those are the elements that make this stress so overwhelming. So this is what we would experience because we are not robots, we are humans. I think of a string instrument. When you pluck a string, it's going to vibrate. And that's what stress does to us. It shakes us up. Now the question is, do we have any control? Can we somehow make this instrument settle and not keep going forever? That string, can it settle? And that's where our own intentionality, the choices we make, start coming into play. So let me take you back real brief into a little bit of neuroscience. This brain of ours essentially has two consultants. One consultant is our immediate consultant, the one that tells us, I see an animal running at me, I have to run for my life. I do not have to become philosophical about anything. I just run for my life. That consultant is fight or flight. It is very helpful when we are faced with physical dangers. Now, when we are faced with other type of dangers that our modern brain sees, the emotional dangers, then this fight or flight brain actually pulls us down, because every thought of the uncertainty, of the fear, of worry is like an emotional beast charging. And every time this reactive brain says, let's fight or flight. Well, the reality is emotional dangers do not lend themselves to either fight or flight. So we end up getting depleted, exhausted. And that's why exhaustion and fatigue, it becomes a big emotional drain on us with these type of situations. So that's when we need our other thinking consultant, the rational part of brain, which puts some reins on this reaction. That is our upper brain, the prefrontal cortex. That brain says, yes, there's a problem. Yes, we have to deal with it, but realize it's not life or death in this moment. We have something we can think through. We have something we can do even in this lack of control moment. So what is that? Let's figure it out. For example, you chose to do some comedy videos when you were really not feeling in a good place. You chose something that would uplift you in the moment. That's the control you created there. Otherwise, the fight or flight brain would have just pulled you down further. So there are moments where we have some control, and this thinking rational brain allows us to do that. Now, the problem is this brain is not the first reaction we get. It's the fight or flight we get. So we have to learn to tame the fight or flight so that we can take back charge. And that is training our brain. Now, when we do any training, we need some direction. We need some tools. So we have a couple of tools we deploy. One of them is our attention tool. So I ask my patients many times, they come into my office and I say, okay, when you leave this office, if my desk attendant asked you, tell me about 20 things you noticed in this office. It's a boring office. But, you might come up with those 20. It might take you a lot of thinking to go back and say, what did I notice there? However, if you were alerted ahead of time, chances are you may write 30 things. So what happened? It's about deploying attention. Where was my attention when I was in that room? And what happens is what we attend to becomes our experience. And a series of experiences becomes our life. So we have to sometimes choose what we are thinking and experiencing so we improve our quality of life as we do everything right for the medical side of things to be taken care of. So attention by design sticks to problems. We were in the jungles as humans not too long back. And if our ancestors were having a great time in the jungle and enjoying the beauty of the stars and never watched for the tiger, we would all not be here. So they learned that threat is important, watch for threat. But in this modern world, this watching for threat constantly actually has backfired because the acute stress has turned into chronic stress. And chronic stress, we know biologically is not our friend. it pulls down our immune system. And an immune system is our friend. It fights off infections. It allows us to fight off cancer. And too much stress creates inflammation. And we don't want too much inflammation. It also creates autoimmunity. And it triggers our sympathetic system, the fight or flight. So it creates a milieu where we cannot relax. And attention by design goes to all threats. So now we say, okay, I understand. That's my design. It's not my fault. What do? Well, let's try to pull attention to something else that can be fun for it. Now, attention doesn't want to stay to boredom. There are experiments, fun experiments, where people were asked, do nothing or give yourselves a mild shock. It won't kill you, but you won't enjoy it. People would rather shock themselves than do nothing. That's how humans are. So boredom is not going to catch our attention. We have to become creative to pull it to something fun. And a couple of ideas I'm going to share with you to pull the attention into something that is more enjoyable so it doesn't go back to the threat all the time. We will have to process our threats, no doubt, but we don't need to do them 24/7. That's the idea. So right in the morning, when we wake up, we can steal our attention to gratitude. And gratitude for people in our lives. You started this care bridge, people were there for you. I also have to mention it was a bi-directional benefit. You made them feel worthy as they tried to help you. So gratitude works both ways. But in the morning, as we are trying to train our attention using the anchor of gratitude, we want to let the face of 2, 3, 4, whichever number of people you pick in front of our eyes one by one. And we say, okay, I'm in the bed. My eyes are still closed. I let this first person's face come. And this could be a loved one, a friend, a neighbor. And we just look into their eyes virtually, watch them smiling, think of a nice act they did for us, and send them a silent thank you. And imagine in that moment, are we safe? We are, because we are in a place where we are being cared for. And behind the scenes, we cannot fight or flight and feel safe at the same time. So we turn down the sympathetic system and feel safe. We created a little silo of safety with using gratitude. And we can do this with 3, 4, 5 people. And the fun thing is that all these neurochemicals that change stay that way for a few hours. That's what research shows. It helps us through the day, not just in the moment. So that's one way to train our attention. Now, another way to train our attention is through kindness. And we are in this world of COVID, it has created loneliness. We are not able to see our loved ones or friends as much. But with kindness, we can somehow, in our imagination, through virtual, digital world, etc., do some kind exercises with our loved ones and friends. And the idea is, we know that everybody has some sort of suffering or stress or challenge. Nobody is stress-free. And we also know that everybody is super precious in their own little world. So with those two soft ideas, we say, I wish you well. It is silent. It is not we say. We look at people and we silently send them a good wish. I wish you well. So we connected with a fellow human being and our attention was really in a safe place again. So you get the idea that there are ways to pull the attention away from threat to things that nurture us. And in those moments, attention cannot process problem and safe space at the same time. So we picked an option that is more healing to us. Another quick thought is attention training using novelty. Kids have more fun in life. Kids can just enjoy a boring gray pen. Most adults will be like, really, what do I do with this? So we can train our attention through our nature, like walks. We look at a flower, but we look at the flower we are seeing, and staying with it for a few seconds allows us to get to know that flower. And that is very soothing and relaxing. We're not judging. There's no right or wrong. It is what it is. And we're curious. We're becoming that kid again. So that's another attention training exercise. And there's so much more to this, but I'm just kind of giving a flavor of we can have some control and we can feel a little safer and start healing. So I would have to take a pause, Patty, and have your thoughts on that, because I'm going to then talk about the second tool, which is our attitude tool.
I think that makes a lot of sense. And I think there are, some apps that can help with that.
Mhm.
Calm is one which I use,
Mhm.
which I like, and I know there's others out there.
Yes, that's a very good thought, because a lot of us who have not experienced self-training our attention could definitely use some tools that guide us and allow us to at least visit that safe, happy place and say, aha, this is what it feels like. And then develop our own ideas from there, either through apps or through self-training, or there are structured programs people would tap into depending upon where they live. But absolutely, that's a great start. Yeah. Okay, thank you for that. Other thoughts?
You know, you mentioned loneliness. That is an issue, but I think those things you've talked about can help with that.
Sure.
No, I'm really more interested in the things that you've found that are helpful for, you know, quieting your mind, dealing with the anxiety, and dealing with the stress, because I know that's not good for us.
Yes, yes. So let's talk about a couple more ideas here. One thought is that, you know, when we are dealing with excessive stress, cumulative burden of stress, one option for us is to make it such that we can handle it, like, let's pick the load of the next hour. That's one little start where we say, it's too much for me to think about the next week, the next month, or longer. I just want to think about the next hour. And I want to make it such that I live through it with joy if I can, and not having to worry too much. And breaking it down into smaller segments like that sometimes makes it easier. Doesn't fix the problem, but we are in a different space. Now, as we're talking about the attitude side of things, one approach is self-compassion. I think you mentioned a couple things on that account. You said choosing humor is self-compassion. Having good self-care, making sure you look good, making sure you eat right, you sleep well, you exercise, you connect with friends and family, is all good self-care. And that is a huge part of healing through the journey. You know, there exists the cure and the healing. We're talking about the healing, many aspects to that. So self-compassion about many other things. There are things that do not go well, even if after we try. And that's still a moment to pause and say, I did my best. This is the best I can offer under the circumstances. So I will celebrate what I could do. That's self-compassion. The tools that allow attitude training also include gratitude. Gratitude is one of the tools. It gets tricky when we're talking about other tools, because in the situation of cancer, it's difficult. You know, I'm not grateful for anything. It is a tough spot to be in. And once I feel that the treatments are kicking in and I feel just a little bit, okay, if I let myself get pulled down with the weight of the problem, I cannot do anything about it. So I invoke some gratitude for the situation in which I could get some help from friends. I could get a good medical care. So I try to focus on that little silver lining sometimes to say, okay, there is still a little bit I can hang on to, which makes me feel better and start to heal. That's where gratitude comes in. Okay. So we talked about some compassion and gratitude. Forgiveness. There's a lot of self-blame. People are sometimes saying, I could have done this or done that. Well, we all know about the retrospectoscope, where you can see through the lens of the past and say, this should have been, or that should have been this way or that way. Well, under the circumstances, we did our best. Most of us are doing that. So really not judging our past from the lens of today is self-forgiveness, allowing ourselves that grace that, you know, I didn't know any better, so I did the best I could. And that takes away some burden, because we're trying to just be a little lighter, right? In terms of meditation, I think a lot of people are trying mind-body approaches using meditation. So let me ask you, if I were to give you a pill that took away some worry for the moment, allowed you to have some deep breaths, brought your blood pressure down, made you feel lighter, would you take it?
Sure.
And it had pretty much no side effects. Let me add that. Okay.
That would be important.
That's our meditation pill. Meditation does all of that and more. So the idea of meditation is that when we sit and focus our attention on something that brings calm and peace, we are retraining our chemicals in the brain to go the route of rest and digest rather than fight or flight. And the benefits then are our blood pressure goes down, our immunity improves, our inflammatory chemicals go down, and overall we are aligned with the path of healing. So meditation comes in many flavors. There is no right or wrong. You know, some people like to meditate on breath. Others might meditate on a mantra. Some people do guided imagery. Some people can just do a body scan. All these ideas take our mind away from looping, from rumination. That 2:30 a.m. in the morning when we are not able to sleep, what is the mind doing? It is doing the what ifs. It is catastrophizing. So the mind is playing with imperfections. What if the mind could be pulled away and it's now playing with something more relaxing, no problems to be solved? The brain can get some respite and it can feel a little more relaxed. And that's what we hope from meditation. Now, meditation is difficult. Anybody who's tried it will tell you it's so difficult because the thoughts come. And that is where the mindfulness meditation comes in, where we accept that, yes, thoughts will come, where we don't judge ourselves or the thoughts and let them flow by so we can engage with the moment deeper. And that's what the benefits come from, that we are not judging anything. We're just being in the moment. So the core of mind-body practices is that we are taming our mind to not go the place where there is no healing. We are bringing it to the place where it can start healing, and the mind over body is aligned towards overall health. I hope that makes sense there.
Absolutely. This has been really, really helpful and given me some really good things to think about. So I really appreciate your taking the time to go through this with me.
Absolutely. Any other questions, Patty, before the session ends?
No, I think we've covered it. I think I just have some homework to do.
Okay. Well, thank you so much again for sharing your story and for allowing me to be part of this conversation here.
Thank you.
Wow, that was wonderful. Patty, thank you so much for having such amazing conversations with Dr. Milstein and Dr. Sood. I want to invite all of our panelists back on screen. So, yep, by video, and feel free to unmute yourself. Thank you all for being part of this webinar, part 4. We have some excellent questions that have come in from our attendees, both before tonight as well as during the sessions. So now we're going to start the live Q&A session. And those of you that are attending, as you think of other questions, please feel free to write them in under the Q&A section or button on Zoom. So I think we'll start out. I'm going to start out with a question for Patty and Dr. Sood, because we were just learning about mindfulness and gratitude. And so how do you remind yourself to practice gratitude and thankfulness and mindfulness and meditation, especially when the day can get long and busy, and thoughts can kind of keep going as we just heard?
One thing that I did is in the local shop, there was a poster size tree, and it was called the thankfulness tree. And it came with leaf-shaped Post-it notes. So I could write, and at the bottom it says, I am thankful for ... And on those leaves, I could write what I was thankful for and put them on the tree. So I kept that front and center in my house. So I'd have to go by it multiple times a day to keep reminding myself that I had many things in my life to be thankful for.
Wow.
Great idea, Patty. If I may add, any new habit is super hard to form, and we need to allow ourselves to be okay with missing it in the beginning, but having some cues to remind us, like you said, it's sat front and center. So in our the program, we train people in for attitude. We have assigned days for different activities, and Mondays happen to be the days of gratitude. So that's one sort of a reminder that today, if I have a stressor, I would try to put it through the filter of gratitude and see what comes on the other side. The other thing we do is train our attention with gratitude. So as I was telling in the video, in the morning, we do that practice. So say you wake up, go to the bathroom, and you suddenly remember, oh, I forgot. One way to remind is a little sticky note on the bathroom mirror. Oh, I forgot. See the word gratitude? Come right back as if we just woke up and start again. A few times this will be needed, and eventually it becomes a second nature, so training. And today we have our peripheral brain, our phone, an alert of some sorts, reminding ourselves. This is my theme of the day. I would hope to accomplish.
Wow, wonderful. Those are great ideas. Are there resources out there, Dr. Sood, that can be utilized when it comes to learning how to practice mindfulness and all of the features that you just discussed?
So several resources out there, some from Mayo, and I'm thinking that we could put them on the chat box, just starting some mindfulness practices. There's, as they say, there are as many ways of doing breath work and mindfulness as the number of people teaching it. So really, one needs to know that there's no right or wrong. It is whatever makes sense, with the idea that we are putting some reins on this running mind and using breath as an anchor or mindfulness as an anchor, whatever that is. But I would suggest not doing 20 things, because we need a learning curve happens when we invest in something. So trying 2 or 3 different things and then staying with whichever makes most sense. And of course, web has a million different resources, so people could look into that as well.
Especially with COVID, a number of online sites have provided guides for meditation, etc. I would specifically cite Gilda's Club, which has online classes, and Gilda's Club is for women with ovarian cancer. And there are a number of different classes through that website that are all online that people can sign up for.
Wonderful. That's wonderful to know. I'm betting that online has, when it comes to, Patty, you alluded to the fact that you've spent more time with MOCA online in support groups. I'm betting that there's a lot more resources out there now than there was before COVID.
Absolutely. And MOCA's done a great job.
Wonderful, wonderful. So I'm going to pivot a little bit to Dr. Milstein. There are a few questions that I think one of them, and this is actually coming from me as a provider who doesn't provide chemotherapy. You did bring up the kind of high dose vitamins component of things, and I'm aware that there are places. This is not something that's done at Mayo Clinic, but there are places where IV vitamin C is given as part of the chemotherapy regimen. Can you comment a little bit on that as far as safety versus not being safe?
Certainly. I mean, there are a lot of boutique practices that will provide you infusions, whether they are high dose vitamin C or what we call nutraceuticals, vitamins through an IV. They tend to be quite expensive. They can be safe, and they can also be dangerous. So it's a very hard journey to walk and to sort out the quality information from the reach for something that you're hoping will provide that added benefit. So I would encourage people considering to get infusions like that to work with somebody who doesn't have an agenda in selling them something for advice as to whether or not they should be using it. So as you've mentioned, at all of the Mayo Clinic sites, we are not using infused vitamin C. you can achieve a supra-physiologic level of vitamin C by using an infusion. You can't do that by taking oral vitamin C, or like I said in the video, eating an orange. There's some historical interest and a lot of emotion and a lot of business behind using vitamin C infusions in cancer care, but not a lot of science. And as I mentioned with the antioxidants, the fear is often when you're taking, for example, chemotherapy or you're receiving radiation, are you blunting the effect of the conventional treatment for which we have science that shows that it works? So I would caution people against using the infused vitamin C. And if they want to use other infusions, like I said, to review that with somebody whose business model is not dependent on whether they're spending their money for those therapies or not.
Great. That
And
was
I was just going to add, I think, you know, as a treating oncologist, I think the worst case scenario is you not sharing it with your oncology team. And so just share and ask about it. At Mayo, for example, if you're someone who is on several supplements, we often, our sort of general guideline is to go off of most supplements during chemotherapy because of the potential interactions. We also have the ability of doing things like a pharmaceutical consult where we can sort of look at interactions. And I think those are really important. I find sometimes we don't ask, or we ask about medications and people don't realize that we're also asking about supplements. And it's just so important that you have a trusting relationship with your providing radiation doctor, surgical physician, or medical oncologist. And we want to know about those things.
Yeah, and are there any, Dr. Milstein, are there any supplements that people should just really stay away from because they're known to be dangerous or known to interact with cancer therapies?
Oh, absolutely. There are many that are potentially toxic that could have an impure product, which could be toxic to the liver or to the kidneys. So I completely agree that when you're giving your medication list prior to an appointment, it's really important that you're including the supplements, and ideally you give as much specific as you can. So I think in the video, Patty mentioned she was taking a bone support. Well, that could be any number of things. So actually put the number or the name of the product and how much you're taking. There are things like Laetrile, which is apricot pits that has been contaminated with cyanide and led to a lot of pediatric oncology deaths. That's recently been relabeled as vitamin B17. So it is still just as toxic, it's just switched names. So that would be the one that first came to mind. So even if it sounds like it's benign and likely to not do harm, it's really important that you're reviewing what it is and what what's the likelihood it's going to benefit me and what's the potential for harm. And that's what you always want, is more benefit and not so much harm. And if you know something's potentially going to cause harm, you better have strong evidence to show that it's got benefit, like we have with chemotherapy.
Great, thank you. I'm going to go to some of the questions that we got live today. This one here is also for you, Dr. Milstein. How much vitamin D should a person be taking while they're doing chemotherapy?
So vitamin D is really tricky because everyone requires a little bit different amount, and it will be based on the tone of your skin, where you live, how much sun you are exposed to, whether you wear sunscreen. So many women wear sunscreen in their just normal makeup products. They don't even think about it. So I think the best way to say it is that we know low vitamin D is associated with several cancers, including ovarian cancer and breast cancer. But what we don't know is that when we replace vitamin D, do we prevent those cancers, or do we prevent recurrence of those cancers? So that's an extrapolation of that data. And that is why I feel very strongly that if you're taking vitamin D, you're trying to land on a level that's within a window that's comfortable for both you and your treating providers. Mine is typically 30 to 50. And in some cases, people will push either end of that, but 30 to 50, I think, is pretty safe. So for some women, that's 1,000 IUs a day. For some women, it's 4,000 IUs a day, which is why checking that level is important to just make sure you're not landing far out of that range on either end.
Great. Patty, you had mentioned in the first interview with Dr. Milstein, the concept of clean protein. Can you talk a little bit about clean protein and how do you know what you're eating is clean?
By clean protein, I mean organic and free range. So, 10 years ago, 5 years ago, it was a lot harder to find. Mm-hmm. Nowadays, they sell it at most stores, but, I like Whole Foods, but there's Fresh Market, there's all sorts of places you can go. They sell it at Kowalski's, Lunds and Byerly's, the local stores. But looking for those products that aren't GMO, aren't no antibiotics, none of the BHG in the milk or the beef. I also try and keep the amount of red meat in my diet lower and eat more chicken and turkey. But again, the free range, and if you can get free range and organic, that's from what I've read, that's the cleanest.
Thank you. I'm gonna go and talk a little bit about neuropathy. So one of our attendees has a question about chemotherapy-induced neuropathy in the lower extremities. How does that interact with reflexology? Is one question, and then the second one is: has acupuncture been shown to be beneficial in treating pain associated with neuropathies?
Assuming that's directed at me. So there is some evidence for chemotherapy-induced neuropathy having a benefit with acupuncture treatment, but like Patty's story, it's not the kind of thing where you try it and you just keep going week after week after week, but it's certainly something that we regularly incorporate into the care of our patients who have neuropathy associated with their treatment. You could use a massage in this situation, although if your neuropathy is in your feet and you're going for reflexology, which is in your feet, that might be more uncomfortable than it is beneficial. So my comment about reflexology and pain was really more around post-surgical pain and generalizable pain, not necessarily neuropathy. There's a supplement I use pretty commonly for neuropathy, and its strongest data is in diabetic neuropathy, which is quite common, not really strong data for chemotherapy-induced neuropathy, but that's alpha lipoic acid. And the dose on that is 1,200 milligrams daily. So the trick with that is if you are going to take it, you need to take an adequate dose. So a lot of products will be 100 milligrams. Well, my opinion is you're either all in or you're out. Don't just sprinkle a little in and see if it's going to have an effect. But again, just like any other supplement, you want to review for interactions or any cautions when you're using that.
Thank you. I'm going to pivot back over to Dr. Sood. Is there any association between autoimmune disease and the stress associated with chemo and the trauma associated with your body going through cancer treatment?
So I will have to answer the question in a more general fashion, not stress associated with cancer per se, but there is good data showing that stress has been associated with the immune system doing everything in the wrong direction. So when there is chronic stress, the body pumps out chemicals which are inflammatory. They can attack our own cells, hence the autoimmunity predisposition is correlated to that. And also excessive inflammation damages our systems, as we know that the lining of the blood vessel being very thin, endothelium, too much stress chemicals can erode that. And we all hear about stress-related heart problems and, stroke-like symptoms and such. So stress is affecting our immune system in not so positive ways over a period of time. And from the point of view of our immunity fighting off infections and cancers, as I mentioned in the video, we definitely want it directed in the direction where it is killing the bugs, but not our own cells. And chronic stress does just the opposite.
Thank you. Another question about diet and oral intake, and that is there an effect that the pH of your body has on cancer? Is there anything to drinking water with lemon or, you know, citrus, high levels of citrus, aside from what we talked about when it comes to vitamin C?
So there's no scientific evidence that so-called alkalinizing your diet is beneficial in terms of cancer prevention or cancer treatment. Now, I'll mention, however, that the standard American diet, the way the typical American eats, is a very acidic diet. So if you're going from a diet of soda, cheeseburger, French fries to fresh food, the healthy proteins that we've heard, and water with lemon in it, there's definitely benefit in that shift. So it's not about the acid-base balance as it is shifting toward a healthier diet. Some people will drink more water when they put lemon in it. So there's some benefits to it just in terms of it quenching your thirst or being better tolerated or people feeling it's more delicious, but you're not actually changing your body's pH, even if you're dipping your urine and seeing you're changing your urine pH. That's just your kidneys maintaining the balance to try to offset what it is that you're taking in. So the alkaline diet tends to be a very healthy diet, so don't discourage it. But if you're looking for places to spend your resources, your money on buying alkalinized water or your energy on getting that as well, I think those things could be much better spent with Dr. Sood's gratitude practices and managing your stress than necessarily buying more alkalinized water.
Right, thank you. We've got a couple questions about CBD oil and then another one about Marinol or Dronabinol. What are your opinions on CBD or Marinol? I know I'm kind of lumping them together, but they're a little bit different, but opinions on those from a medical standpoint.
So I think this is a situation where the horse is before the cart and we're in a bit of a mess. We don't have good scientific evidence for the use of cannabis or CBD products. It's very difficult to know the quality of the product that you are getting. And so I would encourage people to talk about their specific products with their treating providers and to understand these are not risk-free products. So you could be getting things with contaminants, you could be getting things, or excuse me, you could be getting items that have, for example, THC in them, even though they're labeled as only CBD. So you have to be really, really cautious that you're not putting yourself in harm's risk for the use of these. Now, there are other side effects to these products and medications like appetite stimulation or their calming effects. So I think as providers, we would love to know how to utilize these products in the most directed and safest way. But I guess I can only speak to Arizona. It's just very hard to help people with adequate dosing and maintaining the potential harm effect of using the products. And I have experience with both patients who use them to help with sleep and appetite and are getting a good response. I have a patient who took a product, she fell down, she fractured her face, it changed her life. So we just have to be really, really cautious.
Wow.
Yeah, and I'd reiterate that it's very state specific. So for example, I would say in Minnesota, there is providers who certify that you have a condition, and chemotherapy-induced nausea, vomiting, or appetite suppression is actually one of those indications in Minnesota. Every state is different. And then you go to a dispensary, and at the dispensary, there are people who are very specialized to talk about CBD versus THC and what kind of ratio you need. It's very expensive is the other thing. So I would just say, again, when you're kind of balancing things that are similar to everything, it's about sort of choosing a little bit of a menu and trying to see what works, and also balancing sort of evidence and what's working for you, what's in the evidence, and the costs. So
Thank you. I want to get to 3 more questions before we start wrapping up. This one's a bit of a challenging one. what are some of the tools that are out there that can be used to help strengthen a resolve to go through the surgery, the radiation, or the chemo, or all of it, as opposed to deciding to pursue treatment, not to pursue treatment, and continue living a good life? Anybody? It's a hard one.
I think for me, it's a personal choice. And for everybody who goes through treatment, it's a different experience. And some people fare better, some people don't fare as well. And I think all of that gets weighed in making that decision. If you and I've gone through treatment twice now, and I will say my second time around was a little different from my first time around. So there's no necessary consistency, but it's a weighing process and deciding, if you want to go for it and try and extend your life more, or if you're content with how your life has been and you just want to live out the rest of your days feeling good. Because when you treat, you don't feel very good. So it's such a personal decision, and I'm not aware of any apps or any aids to help in making that decision. I think it's kind of the sit down with the pro and the con page and writing your pros and cons.
Wow, very, very wise, very wise. The next question that I have is actually for Dr. Kumar. And this was a question that came up in a previous webinar, but it actually seems like it may fit even better here. When it comes to ostomies, what kind of resources or support are out there for women living with an ostomy because of their cancer surgery?
Yeah, that's a great question. Ostomies are really challenging. They're particularly challenging if you wake up after surgery having an ostomy you didn't know about. So first I would say, if you and your physician before surgery talk about the possibility of an ostomy, your best, the data actually shows if you can meet with an ostomy team or a wound care team pre-op and get sort of the information, that sort of anticipation and planning is very helpful. The second is ask your surgeon or your healthcare provider to refer you to the ostomy nursing team. So most healthcare centers, certainly at Mayo we have one, has a stoma clinic, which is run by just the most expert nurses. I mean, they are really the people who have taught me a lot about ostomies, and they're the first phone call I make when I have a patient who I don't know what to do with their stoma, or I'm having issues with fit around their stoma. And they're incredible. If you don't have a specific stoma team, wound care clinic would be the next best option. We're at Mayo actually developing right now through the colorectal surgery group, but we're in collaboration with the gyn-onc group, a sort of app-based program to help patients with ostomies, the sort of troubleshooting. So those are the best advice I can give.
Excellent, thank you. And then the last question, this has been an evolving time in healthcare in general when it comes to COVID and the COVID vaccine development. And so this question's come up a couple times, and I'm wondering if we have any updated answers to this. What do we know so far about the COVID vaccine when it comes to being recommended for cancer survivors? Should they be getting the shot? What are our recommendations? And I know that it's a constantly evolving situation.
I can only comment on a presentation we had literally this afternoon in Arizona. Somebody asked a question about the vaccine in immunosuppressed patients, and the infectious disease specialist said, to his knowledge, there was no data in using this vaccine in immunosuppressed patients. So if you're in that stage of your treatment, I would be just paying attention to whether there's data that comes out to support that use or not.
Yeah, I would say that if you are through treatment and you are currently not on tumor-directed treatment and considered essentially immunocompetent, that you would be probably in that higher risk group. Now, from my understanding, although this is certainly not my area of expertise, is that that'll be sort of likely in that second or third wave of people who are qualified for the vaccine. And so I would pay attention. I agree with Dr. Bacham Gomez. This is literally changing every day. I think the data is changing every day. And so I personally am looking forward to getting some guidelines from SGO and ASCO, our sort of national cancer provider group. I think that my understanding, although please correct me if anyone knows different, is none of the trials had patients on active treatment. So patients on active treatment were not on any of the trials, similar to like pregnant and lactating women. And so I think it's gonna be a little unclear for some time. I also would reiterate that the social distancing and masking and staying COVID protected, even in the setting of people getting the vaccine, friends and family getting vaccine, I still think it's a really important aspect of keeping patients safe and healthy, and all of us safe and healthy. So
yeah, I would just second that, because if we don't have data to support, its efficacy, it doesn't appear as though it would be harmful because it's not a live virus. But if we don't have data on efficacy, we have to continue to do the things that are keeping us safe right now. All right, well, I want to thank our panelists. I want to thank our attendees. I'm going to turn it back over to Dr. Kumar to wrap up.
yes, well, thank you so much. I know we're just a couple minutes over, but I just wanted to say thank you to our panelists. This was an incredible discussion and just so important. I've learned a lot, taken some notes for myself, actually. At the end of the broadcast, a survey is going to come up. And if you have a moment, just take the time to fill that out. It just allows us to continue to improve our educational content and courses we offer. And this concludes our webinar series. So I just thank you to the audience for sticking with us and your excellent participation and questions and all the tolerance of the technical glitches we've had. We really appreciate you kind of going in through this new environment and this new time with us. All the presentations will be available in the future, both on the FWC and through Mayo Clinic. And so you can take a photo of that QR code, or we will have those resources available. And thank you so much. Thank you so much, and good luck, and have a great night and stay safe.